Namaste, myself Dolly Saraswat from Apollo Hospital, Ahmedabad welcomes you all. Before starting the round of questions and discussion, there is one thing common in all of us, and that is food. Food, which is delicious to eat, can sometimes cause food allergy or food intolerance. And this we will be going to discuss in our today's live session. And with us today joining Dr. Apurva Shah. He is MD DNB in Gastroenterology and currently working as consultant in Gastroenterologist, Hepatologist and Gastrointestinal Endoscopist. Namaste, sir.
Namaste.
Sir, my first and foremost question for you is that what is adverse food reaction?
Yes. Good evening. Today for next 20 to 25 minutes, we will talk on adverse food reactions that are food allergy and food intolerance. So when we eat food, normally it does not cause any reaction or any symptoms. So after taking food, when we get symptoms, it is usually termed as adverse food reactions. The types of adverse food reactions are mainly of two types. One is food allergy and second is food intolerance. The importance of both of them is that in India there is no registry for food allergy patients. Demographic says that approximately 10% of the population, the prevalence is approximately 10% of the food allergy. So 1 out of 10 persons is suffering from food allergy, specifically in the developed countries from the literature available. Yes.
Yes, sir. Sir, very important question is that what is the difference in food allergy and food intolerance?
Yes. So the term both food allergy and food intolerance both are different terms. First I will talk about food allergy. So it's an immunological reaction to the food which we eat. So when we eat food within minutes or hours, 2 or 3 hours, when we get some symptoms, these are known as food allergy. So it's an immunological reaction to the ingested food. Usually the symptoms are not only of gastrointestinal tract, it also involves other system involvement that are like skin involvement or respiratory tract involvement. Other important thing regarding food allergy is even a small quantity of food that can cause significant symptoms. While if we talking about food intolerance, it is basically a non-immunological phenomenon to the food. So all over the symptoms will be there. They are only related to gastrointestinal tract. In food intolerance, you will not get other system involvement like skin and respiratory tract involvement. In food intolerance, other important difference is small amount of food can be tolerated by the patient. So when you take larger amount of the foods, that can usually cause food intolerance. So there is a difference between food allergy and food intolerance. Yes.
Yeah, okay, sir. Generally, people used to get confused between both the terms, and now we get to know about it.
Yes.
So, my next question is can you tell us some common foods which cause food allergy and food intolerance?
Yes, that's a very valid and important question. So, common foods which causes allergy, specifically in Indian populations, food allergies are usually more common in children's. But it's not that it is not common in adults also. But the common foods which causes allergy are cow's milk, peanuts, tree nuts, eggs, fish, shellfish, soy, and wheat. These are some of the 6 or 7 foods which are implicated for more than 90% cause of the food allergy in India.
Okay, sir. So, what are the risk factors of causing food allergy?
Yeah. So, what are the persons why patient gets food allergy or what is the risk factor for getting it? So, first most important risk factor is family history. If your father or mother has a history of food allergy, the chances of getting it into the children it's very high. If your both parents are allergic to some foods, getting food allergy in the children is quite common. So one risk factor is family history. Some race and ethnic factors also play a role, like Asians and black Hispanics are having more food allergy as compared to US and UK people. And children or adults who has got other allergic condition like allergic rhinitis, allergic dermatitis, they are likely to get more predisposed to food allergies. So these are some of the risk factors which are important why they are getting food allergy.
Okay, so my next question is that talking on food allergy only, that
Yes.
what are the different types of food allergy?
Okay, okay. So it's basically a medical related mechanism. So different types of food allergy were defined by the body's response in terms of immunology. So when a patient's when our immunity reacts to some food, they are basically of two types. One is IgE. It is a protein which is present in the blood. So when you eat some particular food, this protein in the blood get released and attached to some cells like mast cells, and it releases some kind of chemicals known as histamines. These are causes the various symptoms of the food allergy. So one type is IgE mediated allergy, and other types are non-IgE mediated allergy where cellular immunity plays a part, out of which eosinophilic esophagitis, eosinophilic gastroenteritis, protein losing enterocolitis, and protein losing proctocolitis. These are some of the terminologies which are used when it is non-IgE mediated. So basically it is of two types, IgE and non-IgE mediated food allergies.
Okay,
Yes.
sir. So apart from food allergy and intolerance, a very important thing is that how one can get to know, or you can say it as symptom that one is having food allergy or food intolerance.
Yes. So, what are the symptoms? Why, how can you know that whether it is food allergy or it is a food intolerance? So, as I previously mentioned, in food allergy, you get gastrointestinal symptom as well as symptoms other than the GI symptoms. So, first I will talk about gastrointestinal symptom. So, if you eat food and you will get nausea, vomiting, abdominal pain, and diarrhea within a minute to hours after taking food. So this is usually related to food allergy. But not only the GI symptoms, along with that, you sometimes have rash, red color spots in your skin. Sometimes there may be swelling in your oral cavity, lips, facial swelling. These are common. And sometimes it can be life threatening. Sometimes the food allergy can lead to respiratory problem, breathlessness, asthma type of episodes. And one life threatening condition is anaphylaxis. So some people can get anaphylaxis, life threatening situation from the food allergy. While if we talk about food intolerance, the symptoms are usually mild and they are not life threatening. Food intolerance usually causes bloating sensation in your tummy, gas like sensation, and sometimes diarrhea. The commonest example is a milk. So, lactose intolerance is the terminology. When you get milk or dairy products, some people have a bloating sensation or gas sensation in the tummy. They have to go 2 to 3 times loose motions after taking milk. So, this is known as lactose intolerance. So these are the common symptoms associated with both food allergy and food intolerance. So if in terms of food intolerance, they usually occurs in hours to days rather than minutes to hours, which occurs in terms of food allergy. So this is a difference between food allergy and food intolerance symptoms.
Okay, so if any of the person is having any symptoms, as Dr. Apurva Shah said, to can consult to the doctor immediately. Sir, as we all are very health conscious nowadays,
Yes.
talking about COVID-19 or generally, especially we all youngsters.
Yes.
One day, even though I was also Googling it, and there was a term which is very popular nowadays, that is gluten. So
Yes.
what actually it is?
Yes. So nowadays, previously in Western countries, the gluten term is quite popular. But nowadays in India also, people are now realizing the importance of gluten. So gluten is a protein which is located in the grains present in the wheat, rye and barley. These are the three grains which contains a protein named gluten. So the terminology is important because if genetically predisposed person takes this food, whether it is wheat, whether it is barley, or it is rye, for a longer period of time, it causes small intestinal malabsorption. That means it causes damage to the small intestinal mucosa, and person is likely to get malabsorption syndrome and its symptoms like short stature, anemia, swelling on the liver, and other manifestations. The disease is known as celiac disease basically. So if you heard the term celiac disease, it is also from the intolerance to the gluten. So if you take gluten for a longer period of time in genetically predisposed individual, it causes celiac disease. But one point I want to tell you, there are three terminologies. One is wheat allergy. Some patients get allergy with the wheat. That is not same as the celiac disease. Other terminology is non-celiac gluten hypersensitivity. That means in both these conditions, your blood test and endoscopic findings are normal, but only you have a allergy to the wheat. So that is a different terminology. But if you get disease, that is celiac disease, caused by a gluten intake for a longer period of time, that's a different disease. So whenever you have a query regarding wheat allergy, non-celiac gluten hypersensitivity or a celiac disease, consult your particular doctor. They will help you to differential diagnosis in this matter.
Okay, sir. Means rather than searching on Google, we can directly
Yes.
consult to the gastrophysician.
Yes.
Sir, my next question is: you being a gastroenterologist, many patients used to come regarding allergy or intolerance.
Yes.
What are the diagnoses which are preferred for food allergy and food intolerance?
Yes. So first, regarding the diagnosis of food allergy, the most common is symptoms. If patient presents with symptoms which I mentioned earlier, in minutes or hours after taking food, usually it's a food allergy. But to confirm that, there are few tests are available. Out of that, most commonly used in the clinical practice are two. One is skin prick test, in which one injection of the allergen is injected in the skin, and then we see the reaction in the skin whether patient particularly develops some redness over that. That is skin prick test. Other test which is available is food specific IgE antibody. That means if you are allergic to egg, specific antibody is formed in your blood. So if it requires a serum sample, blood sample, and it measures a specific antibody. It's IgE antibody. So all the allergens, like I have said, peanuts, eggs, milk, soya, fish. So specifically IgE antibodies are available. The tests are already in the market. Immunocap is the name which is available. So that is food specific IgE antibody. These are two tests which are commonly used in practice. Other thing is rechallenging. That means person if get the symptoms once in a day, you can challenge that the similar items. When patient eats a similar item second time in, he gets a similar type of symptoms. That means patient is allergic. But this practice of rechallenging is not good because sometimes it can lead to anaphylaxis. So this is a re-challenging test we generally don't use in our clinical practice. So practically speaking, skin prick test and IgE antibody, these are the two tests which we are using for the food allergy. Regarding food intolerance diagnosis, the commonly is the lactose intolerance. So for diagnosis of that lactose intolerance, we are using hydrogen breath test. It is a test available where we tell the patient to drink a liquid containing lactose solution. Lactose is basically a sugar which is present in milk and dairy products. So patient is asked to drink that liquid, and after few minutes to hours, we check the hydrogen level in the breath samples. So it is a breath samples to diagnose food intolerance. So these are the diagnostic methods by which we can diagnose food allergy and food intolerance.
Okay, so my next question, and all our viewers might be waiting for this only, especially when we discuss regarding anything,
Yes.
and that is the treatment of food allergy and food intolerance.
Yes. So first thing, as I mentioned, the diagnosis of the food allergy. So by previous diagnostic methods, skin pricking test and IgE antibody, which is food specific, we can diagnose food allergy. Sometimes there are certain food allergic conditions which require a specific diagnostic techniques like endoscopy and biopsy. Like if you are having eosinophilic esophagitis or eosinophilic gastroenteritis, the diagnosis is usually arrived by endoscopy and biopsy. Other also celiac disease. In that also endoscopy and biopsy is important for diagnosis. So once we diagnose the condition, like celiac disease. So if patient had a celiac disease, the treatment is removal of the gluten because it is caused by the gluten hypersensitivity. So patient has to avoid gluten containing grains lifelong. That is the only treatment for celiac disease. Other thing is eosinophilic esophagitis. If patient has got this type of conditions, we generally give oral steroids. Viscous are available, and proton pump inhibitors. These are the drugs which are available for eosinophilic esophagitis and eosinophilic gastroenteritis. Per se, if you are getting food allergies like milk, egg, soya, peanuts, and shellfish, the best treatment is diagnosis to which food you are allergic and avoiding the food. That is the best treatment available. If you get food allergy like rashes, GI symptoms, and respiratory symptoms, the treatment usually of two types. One is antihistaminic drugs, which helps to relieve the itching or rash or swelling in the body, and other thing is epinephrine injection, adrenaline injection, which we usually give in patients who has got cardiorespiratory symptoms or anaphylaxis. So in milder episodes of allergy, we usually use antihistaminics for the treatment. One other important thing here in food allergy is sometimes the children have food allergy, but when they grow up and finish their 10 years, sometimes initial periods children are intolerant of food allergic, but as they grow older in adulthood, when they enter into adulthood, the food allergy will go away. Specifically, milk and egg allergies are usually go away as the children grow up. While peanuts and tree nut allergies, which usually remain persistent uh, even after childhood period. So these are some of the prevention measure as well as the treatment of the food allergy.
Okay, sir. Sir, at the last but not the least, any message you want to share with our viewers?
Yes. So after discussing food allergy and food intolerance, so if you get any of these type of symptoms related to food, just don't Google or don't presume that it is an allergy or intolerance. Sometimes there are certain gastrointestinal diseases which can present with similar kind of symptoms, and they may be severe one. So it is always better to consult your doctor and take an opinion whether it is food allergy and food intolerance, because sometimes you have a bacterial infection, bacterial food poisoning. Sometimes you have inflammatory bowel disease like Crohn's disease. So these are some of the diseases which can have symptoms which mimics like food allergy or food intolerance. So that cannot be missed because these are sometimes be life-threatening diseases. So it is always better to consult your doctor and take proper advice regarding whether it is food allergy, whether it is food intolerance, or whether it is any gastrointestinal disease which is causing these symptoms. Yes.
Okay, sir. Last but again not the least, eat well, enjoy your delicious food, and if you get any of the symptom, as Dr. Apurva Shah said, you can consult your gastrophysician. Thank you, sir, for being us with in our conversation.
Thank you.
Namaste. consult your gastrophysician. Thank you, sir, for being us in our conversation.
Thank you.
Namaste.